At SelectHealth, we have a service-oriented culture. It's built on a strong foundation, and that foundation starts with our mission, vision, and values. We are a values-driven organization, and our values are worth repeating.
As I've said since I've been at SelectHealth, it's really everyone who helps me do my work. Everyone is in sales, and everyone is in service. What are we actually selling? Well, we're selling you, our caregivers. We're selling an experience, and we're creating an environment where people feel security and peace of mind, and where customers feel like they're going to get service. We're not selling insurance. Well, we are, but really insurance is a financial transaction. What we're really selling is an experience that comes from the service that we all provide.
As I think about our culture, it really is a culture of helping people. It's the glue that holds everything together. It really is and should be the motivating force that drives us forward. It's the compassion or caring. It's going the extra mile when no one is looking and doing the right thing even when it's hard. That's the essence of our culture, and that's what helps drive us forward to provide that superior service and do the right thing every time for our customer.
1,600 caregivers and leaders across the system who work closely with the executive leadership team. We are all interconnected. The more we realize we are interdependent, the better we can work together.
As I go about my work every single day, whether it's talking to caregivers or in meetings, working on policies or products or operational workflows, a good question I always try to ask myself is, how is this going to impact the member? How is it going to sound to them? And also, how is it going to impact our caregivers and the work that they do? That relationship between our caregivers and our customers is connected. It's symbiotic. You can't ask our caregivers to treat our customers one way when they're being treated another way. You have to treat them well.
I've always felt like that my job as a leader is really to serve other people. My focus is about how I can help other people succeed. It goes along with this idea of caring. If you treat people with mutual respect and trust, and if my focus is always on other people and not myself, the outcome ends up being better.
One of the most important things we can do to stay connected to our caregivers, I believe, is rounding. I absolutely love the opportunity to talk to our caregivers every single day, to hear about their families, hear about what's going well for them, their challenges, not only in their personal life, but in their jobs.
It boils down to a quote by John F. Kennedy in 1961. "To whom much is given, much is expected."
When I was about 9 years old, I came home from school on a Thursday afternoon with fever. The flu was going around at the time, and my parents thought I had the flu, so they didn't take me to the doctor. As the night went on, however, the pain in my stomach began to increase and became very, very painful, and we had no health insurance, so my parents didn't take me to the doctor. So I laid on the couch in excruciating pain until Sunday morning. By that time, my fever was 104 and I was in extreme, unbelievable pain. My parents finally took me to Primary Children's Hospital, where they determined that my appendix had ruptured and peritonitis had set in. And there was a doctor, however, who was willing to do the surgery for free. After the surgery, the doctor had said I probably had about 15 minutes left to live when my parents had brought me in. I spent the next 30 days in the hospital with multiple surgeries and lots done to drain the poison from my body. That's one of my whys. I know what it's like to be uninsured. A doctor donated his time to save my life, and Intermountain Healthcare covered all of the costs. I still have the invoice for the hospital bill for the 30 days that I was in the hospital. I care because I was once a person who was uninsured, and if it weren't for Intermountain Healthcare and that doctor, I probably wouldn't be alive today. If you break down the word caregiver, the word care means to feel an interest of concern for someone. That's what the word care means in general. Give is an action word. It implies that we're going to do something. When you put those together and you talk about being caregivers, is that we have genuine concern and empathy for others, and we're going to do something about it. I like that idea. Conceptually, the idea of being a caregiver and what it implies both as a member of the SelectHealth team, but more importantly, how we care for each other, for our members, for our providers, for our employers, and for other constituents. That idea of being caregivers really resonates with me. Giving relief to people in their most vulnerable states. This is what differentiates SelectHealth from others. There are a lot of insurance companies, but none of them do what we do.
It's important to connect your work to a higher purpose, one beyond the immediate task at hand. At SelectHealth, we often talk about the culture of superior service and connecting to a purpose larger than ourselves. Our culture comes from within, and it is that spirit that is within so many of you that we will continue to make SelectHealth a very special organization.